goes swimming. But first, I want to start by recognizing your fearless leader for the last couple of years who has joined us this morning for a few, and that is Justice David. So, as you're aware, this has been Justice David's passion throughout his career before the Supreme Court days and in his juvenile court days. So, we've been very blessed in Indiana to have him not only on the juvenile bench, but also on the Indiana Supreme Court. And what a coup for this group to have him as its first chair. So I think the Colonel leaves big shoes to fill, and I am going to do my very best to do that. But today we just wanted him to be here to say thank you. I have a little gift for him today, but I will open the floor if anyone wants to make a remark or two for Justice David today.
You do. I'm entitled to rebuttal. I
don't
know what you're reading up.
May I make a comment in my dual capacity as both a member and as Office of Judicial Administration staff? What I've always appreciated about Justice David is one, his passion and commitment, or your passion around the public, your passion and commitment, leadership around these issues. And as a staff agency for an initiative this big, we welcome the opportunity to work with all of our partners, help guide the process, kind of do the behind the scenes work, and to the degree that you help us through the challenging times and getting through all of that and helping us navigate all of it and giving us direction and guidance and support. I just can't thank you enough for all that you've done, not only in the capacity of the Justice Oversight Committee, but in KDAI and EDM and pretrial and every other initiative that our office has worked closely with you and the Supreme Court on. Thank you very much.
I guess I'll speak up. Justice David, I've always appreciated your ability to.
Can we start over? I can record this, okay?
And I'll probably never have
where are you going today? What are you doing?
Be questioned with difficult hypotheticals in front of the Supreme Court bench by you again, so I can say this freely. I've always appreciated your ability to couple serious, difficult tasks with levity and leadership, and trying to engage people in a way that makes them comfortable and willing to, I guess, drop their guard and collaborate with each other. And that's always been appreciated throughout my work with you over the last 5 or 6 years.
I just want to add, Justice David, that I think Indiana is blessed to have had you and continue to have you. I think it's noteworthy that the two things that you chose to continue doing in retirement were to continue as chair of JDAI and continue as chair of the Justice Oversight Committee. And to me, that demonstrates your passionate commitment to young people. And I don't know, I'm unaware of any other state Supreme Court or that has a person who has dedicated as dedicated as you are to that. And I just very much appreciate that. Thank you.
You know, you go back, I was going to play with the mic. Chief Justice Rush and I were both on the bench and talk. It's much back there. What about this? How'd you handle this? How'd you handle this? I'm stuck with this. I'm stuck with that. All kid related. Thank you for the invitation to be here and pass the baton or the torch or anything like that. I'm not nearly as smart as I used to be when I was on the Supreme Court, but I still know a few things. You are in much better hands than you were before. It is great that you are all here. Many familiar faces, some newer faces to this work. My wife sends her hello. She's back home. So she was gone 2 years, apart from 2 years. She got home, stuff arrived from our apartment in Virginia the next day, and the next day, the two of us and 2 small dogs left on a 2-week RV immersion trip, having never ever driven an RV and having been apart for 2 years, and everything's going just fine. And if you want to know our itinerary and where you camp and where you don't camp and how RVs work, I learned that the hard way. You know, anything that we were able to do together is really a mere reflection of all of you and the people that support you in the various communities, whether those are the different counties or here in IOCS or other agencies. This is yet another example of unprecedented cooperation, collaboration, and consensus building. Still out and about, and love to share this as a story of you can take legislators and executive branch people and judicial people and bring them together, and what you get is a better product. And not everybody has to agree with everything, right? And it's okay to say, that's a good point, Mark. I'm not following you. Or I have a different perspective. And how amazing are different perspectives that enable us to be better and do better, and most importantly, do better for our kids. So thank you for all that you have done and all that you will continue to do. There's a lot of work to do, and it's a great opportunity for our JDAI counties and those counties that have not yet appreciated the value of JDAI, but are on the cusp of that, and to work with the Children's Commission and just so many unique operative organizations. I failed retirement, so I've got a part-time job, a part-time job, a part-time job. So now I'm back to where I was when I was on the court, but I love it and wish you the best. I would tell you that, you know, I'm not involved in this anymore, but I think Nicole may have provided a path, because I think I heard, it's what I think I heard, not what she said before the meeting, that maybe there's an opportunity in Bartholomew County for the JDAI steering committee membership, and there's sort of an event, and she gave me the date, and I'm going to put on my calendar and show up, and just sort of try to muscle my way in.
Very excited.
To maybe help out my hometown. So, Judge, thank you. Couldn't be happier that you are the skipper of this great ship, and do great things, because there's about 1.5 million kids that are depending on you. Kevin, great to see you. Great to see all of you. And we've got some new people, and please keep up the tradition and require the new people to do a little skit to start out with. Judge King is, I told him about that when he arrived, and he's over there pulling up some sheet music or something on his iPad. Yeah. Thank you all very much. Thank you.
And Justice David, don't leave without your gift.
Really good. Good. You want me to open it up in front of everybody? Here, I see some clips. I'm going to read this. Thank you. Where'd you go? There you are. Trivia.
The Trivia King. So yes.
Off the beaten path. So I'm retired. I drink a lot of coffee. Thank you very, very much. Many of you are interested. Catherine and I have scheduled our next bucket list trip. Spots remain. We're not going RVing. Leave, I think, May 1st for Kathmandu, the fall. They're going to hike to Everest Base Camp.
Oh, wow.
So we're scheduled and haven't really started the training, but we'll do that. So thank you, Judge, and thank you for gifts.
All right, so the torch is passed. You're stuck with me now. Just a couple of items of housekeeping. First of all, we are live streaming this, so if you would speak up today so that the microphones pick you up for those online watching. Secondly, if you need your parking validated, Peyton back here, Peyton, wave your hand if you will. We'll take care of that for you today. And third is you have new meeting dates at the bottom of the agenda. We had some trouble getting room scheduling, and so we looked at a different day of the week so that we wouldn't have that difficulty. The other question for the group on that issue is whether or not you like this space or you prefer the government center space. So we had a little bit of discussion about that this morning about is this a more convenient place for parking? I'm good either way. It's the same distance to walk for me. So I will throw that to the group and ask if you have a strong preference one way or the other, here or the government center.
It was cold walking up this morning. So for winter months, maybe the government center.
Other input? Okay. All right, so we have one comment, winter months, maybe government center to avoid walking for some. Summer months, do you like the walk?
Sure.
So maybe we do half and half. We'll talk about that after the meeting, Leslie. Perfect. All right, we have a rookie class of 2023 here, so several new members today at the table. And for their benefit and mine, since this is my first official meeting, I'd like to go around the room and have everyone introduce yourself and your role, as well as the work group that you're on. So we'll start, Mary Kay, do you want to start?
Thank you, Judge Kimberly. Good morning, my name is Mary Kay Hudson. I'm the Executive Director for the Indiana Office of Border Services. Our office is the staff agency for the Youth Justice and Oversight Committee, so we work really closely with you all, both as members in the committee and in the board capacity. And my role generally is to work with Dr. Alsma, and I co-chair the data.
Hi, Dr. Alsma. Matt, I'm a professor at the IU School of Medicine. A lot of the research that I and our group do is focused on youth mental health, addiction, vulnerable youth involved in the carceral system. So I co-chair the data committee with Mary Kay, and I'll talk about some of that work coming up.
Mark Gershaw, I'm the Executive Director of the Commission on Improvement Status of Children. We're one of the core groups that helped kind of form the YJOC from the beginning on county and how we can support those initiatives moving forward, legislation policy change.
I'm Leslie Dunn, the Deputy Director of Children and Families Division at IOCS under Executive Director Mary Kay, and also the staff for the larger YJOC group.
Hi, I am Emily Krauser. I am with the Indiana Housing and Community Development Authority. My title is Chief Deputy Director of Programs, and I believe the Transitional Services Worker.
Carolyn Foley, magistrate out of Allen Superior Court. I chair the Probation Standards Committee. I'm really excited to be back.
I'm Amy Richardson. I'm the magistrate in and I carry the juvenile delinquency.
I'm Tracy Fitz. I'm the juvenile resource prosecutor with the Indiana Prosecuting Attorneys Council. And since I've been on the Oversight Committee, I'm the co-chair of the diversion.
I think Terry Decker, I'm the Executive Director for Division of Youth Services of the Department of Correction. Take a breath because that's so long. Jeez. I was co-chair over transitional services.
Good morning, Sorella Black. I am the Executive Director of Mental Health and Wellness Services with the Division of Mental Health and Addiction. I was chair of the Behavioral Health.
I am Dana Kenworthy, now of the Indiana Court of Appeals.
You're right. I'm an Executive Director of the Voices Corporation, and I facilitated the Youth Families.
I am Faith Rand, the Juvenile Court Judge from Topeka County.
I'm Darren Dolahanty from Wayne County, Juvenile Court Judge.
Hi, King
circuit court judge in Berkeley County, juvenile, County. I'm on the duties.
Nicole Phillips, Bartholomew County Juvenile Probation. I'm Assistant Chief Probation Officer for Juvenile Services, and I was on the screening and assessment committee.
Good morning, Sarah Sailors. I'm the Chief Deputy Director, Senior Advisor for Department of Child Services, and I am a rookie, so I'm not on a committee. Good morning, my name is Nancy Weaver, and I'm the Director of JDAI at the Indiana Office of Court Services. I serve as a member of the Data Committee, Data Worker, and also as staff to the grants process work group that is now on a little bit of a hiatus.
Hello, Devin McDonald. I'm the Executive Director at the Indiana Criminal Justice Institute. I co-chair the grants. I'm Stephen Balco. I'm the Director of School Safety with the Indiana Department of Education, and
I'm Joel Menike. I'm a staff attorney with the Indiana Public Defender Council. I was a member of the probation work group last time. I'm not sure if I'm on a work group now. I need to figure that out. But I want to say I brought over a few copies of juvenile code books that we put together. It's all the delinquency chins, TBR statutes in the juvenile code. And so if you're from out of town and you want one of these, I'll give one to you today. If you want one, but you're at the government center or the state house or somewhere close by, I can bring you a copy.
Right. Welcome everyone, and in particular the rookie class. So we're in this together. Sarah from DCS, Judge King, Magistrate Richardson. I'm excited to have in particular because they lend a rural voice to the group, and so we're excited to have that perspective on the committee. And Emily, as our new youth member, welcome. To give you a little of my background, for those of you who don't know who I am, I've been a guardian ad litem for kids in divorce cases, a deputy prosecutor, 6 years of that time in juvenile court, also prosecuting child abuse neglect cases. So focus on kids in my 10 years as a deputy prosecutor. And then on the trial bench in Grant County for 13 years, and that included juvenile cases. So all of our child welfare cases, and supervised the delinquency docket as well. So also my husband and I, Alex, were foster parents for about 2.5 years. So you can say for the past 35 years, my focus has been largely kids. And so as daunting as this chair position was, it fits very nicely into my passion. And that is changing the system so that we do the very best we can for kids. And as I was looking at all of the moving pieces and parts and all of the department heads in this room, I was getting so excited. So that gives you a clue into how nerdy I am. I like this stuff. I like policy. I like collaboration. And I think it's not a coincidence that the juvenile court is the original problem-solving court. So the court itself started in Illinois. Indiana was second, right on their tails. And the juvenile system is largely based on rehabilitation, collaboration, much more so than the adult system. And so I look at this group around the table and see a problem-solving court, much like the family recovery court team that I left back in Grant County. And so I'm super excited to get started on this work. And in order to prepare for this position, I went back and I read all of the materials from YJOC, watched all of the meetings online, and then also went back further thinking where have we come from, and read reports from 2007, 2008, 2010, so multidisciplinary group reports. And I thought it was interesting to see how many of the recommendations from this report in 2023 match recommendations from 2007, 08, 2010. So data, statewide data collection has always been on the table. A multidisciplinary group to talk about children's issues was in those early reports, and lo and behold, we now have the Children's Commission in Indiana. A juvenile-focused multidisciplinary team was in those early reports, and so we have that in place. there's been a lot of progress and there's still a lot of room for growth. And so I'm very much a roll up my sleeves and get to work person. So I'm excited to get to work today. And so I view this meeting as an opportunity to shift focus from coming up with recommendations and putting them into a written report form into transitioning to implementation. What are the next steps? So to that end, I'm going to go around the room and ask the work group chairs to give a presentation of where we've come from and where you see the next steps being. So I will turn to Mary Kay and Dr. Alston first.
I'm going to start. Mary Kay will help and verify any errors that. Yeah, so for the data group, it's a big, tall ask on the data side of things. We're really proud of the report that we were able to pull together, and I want to acknowledge Lisa's hard work. So thank you for the support that you gave to make that possible. Because it's a lot. It's definitions, there's local variation. Thinking of where we were in the early 2000s with 5 different systems, some pen and paper. So a lot of work has been done and a lot more work to do. So in our report, we really laid out a staged approach because we know we can't just go right to this big state data repository. We really have to make sure that data is accurate and acknowledging local norms around court activities. That's where some of the definitions came in. Great work that JDI did with definitions and building on that work. To get to a staged approach where you can start working with a couple of counties, pulling data to really understand processes, definitions, where to go next, and then building on that with more counties, making sure that we're representative with rural, suburban, urban, as well as representative with JDI and non-JDI counties. There's different norms around the use of data there as well. So it's really a staged approach that will definitely necessitate resources. But I acknowledge that we can do some good work now, but to move that forward, it means that we're going to need more resources to get to the place where we eventually want to be, looking at statewide data, being closer to near real time, to understand how we use this process, how they're going through the system, all to maximize that full benefit of making sure that youth are getting the services that they need and not getting pulled into the system unnecessarily. That's where we want to go. Now, on the practical side of things, Mary Kay, have you update there?
Sure. So as Dr. Oswald referenced in our report, we adopted several objectives or deliverables around definitions of data collection, data quality, and those kinds of things. Part of what we propose is sort of a 2-phase project that they could run simultaneously, but they're both critically important in assessing the data that we have and getting assessment of data collection practices across the state. So we had proposed that we would identify 20 volunteer counties, about 20 volunteer counties, who would allow us to do some centralized pull of some of their key data sets, whether it's through Insight or SRS or Odyssey or even Quest, to get a sense for how complete certain data sets are, and to begin to assess for variation of local practices and how certain things are recorded. And then in addition to that, we had recommended that we identify 5 counties who were really interested in doing some more intensive work in putting into play or putting into practice some of the recommendations that the Oversight Committee had related to data definitions and data input and standardization and making sure that certain events are tracked in a certain way so that they can be pulled. And all this is around kind of an assessment of what would it take to get youth justice data really where we want it to be in terms of being complete, accurate, with the understanding that there's always going to be local variation. So our office, the Office of Court Services and Judicial Administration, is doing some internal work around data and looking at doing some project around data warehousing. As we've been meeting with those consultants, this work has come up in the conversation, and our project charter has placed this project, the 20 counties plus the other 5 counties, at the top of the list as something that we would be Obviously, there's a lot of work to be done in terms of recruiting counties, educating counties, supporting counties in that process. So we're very, very early in the discussions. And there's also a discussion around going through the phases of how can we support the counties who take this on. Counties need their own support when it comes to data collection and quality assurance. And then how can we shore up some of the resources within our offices and perhaps even some of your agencies and making sure that we get access to the information that we need and that it's complete and that we're reviewing it and that we're researching it and all those things. Just to kind of segue just a little bit, our office under 1359 is responsible for writing a couple of reports. One is around local detention policy. Some of you judicial officers would have received a survey from our office. Thank you for that. Around looking at what information courts use and how they use this information to make secure detention decisions. It's a very complicated process. One of the questions we asked in the survey is whether or not there are counties who are interested in receiving some assistance in reviewing or revisiting their policies or even developing some policies from scratch. And we had almost 20 counties say yes to that. So we're super thrilled by that. I think this dovetails nicely with some of the grants that have come out around diversion and alternatives to community alternatives to detention. So that's very, very promising. The other report that we were required to do was on detention overrides and diversion. And I think as part of that process, we have learned some things about just variation in how practices lead to differences in how information is recorded and how information is kept and those kinds of things. So with Lisa Thompson's assistance and members of her team, we've, I think, begun to see some of the things that we will see if we do this 20 county data poll, and as we begin to work with counties more intensely around data collection and data quality and integrity. So I think there's a lot of momentum around what we're doing, and I think we're really excited about moving forward. And if anyone wants to be part of the data work group, I think Matt and I would. You don't have a home yet? Be welcome.
All stragglers.
Yeah. And that's all. Thank you.
Questions for Mary Kay, Dr. Alsma? They have a heavy lift. So Godspeed, and I'm right there with you. So let me know how I can help. I'm going to back up now and backtrack to Devin for a grants update. We'll be meeting tomorrow, right, Devin, to go over some grant applications?
Yes, yeah. I will not be there, but yes, you'll be in good hands, though. So, sorry.
Yeah, go ahead.
Okay, I apologize. Thank you. So we had our first round of grants, and I'll say first round because I'll be honest with you, we're going to have to do another one round. Overall total that we received in funding requests was just over $3.2 million, and that's across all three funding streams. Knowing that we have 60 million across the biennium, 3.2 is not a good number. With that, though, we do have some counties that put some good thought. We have some counties that applied for, we have several counties that just applied for the training grants because they pretty much just said, we know we want to do something, but we don't know what we need. And I applaud that, to be honest with you. I applaud that. Put some thought into it, look into some stuff. And so those counties will obviously need to have another bite at the apple. Once they identify a good program or something that they want to implement, they will need another bite at the apple. So I would anticipate us, when we open a second round of funding, that number grows substantially. Doing a lot of grants every year, this was a really weird application process. We had a lot of organizations that started applications. They just opened it and then never did anything with it. We had some that opened 4 or 5 applications repeatedly, and they would fill part of one out, close it out, they'd open another one, fill part of it out, close it out, open another one, fill part of it out, close it out, and then finally submit it. So it was just very weird kind of how it went through. I reached out to some organizations as well who had complete applications in the system but had not submitted them, and was like, just submit it. we can help get you across the finish line, just get it in there. So we did that. We had a few that were in that kind of boat of kind of on the borderline, not. So, you know, we got a few extra applications that way. Across all the grants themselves, the largest number of grants were under the diversion category. We had 18 applications from across the state, a couple combined counties, which was good to see. So of those 18, 6 of those were planning grants. Like I said, all they did was submit it for the $20,000 in planning dollars. So they're obviously going to need to be more than that. The community alternatives grants, we had 14 of those. And some of those are counties who applied both under the diversion and the community alternatives. So that was good to see. And under 4 of those, four counties applied for planning under that dollar figure as well. Because again, they identified that they wanted to use some sort of alternative program, but they just weren't quite sure what. Some have identified a program, but want to use those dollars to put a work group together, but then also travel to see the implementation of a program and how it works. Most of the times it's in another state, to see how that program works and runs and how they can tailor it to fit their community. So you know, that's good stuff. The behavioral health, we only had 8 applications across the board for behavioral health dollars. With that though, they had the largest total. Overall, they had about $1.5 million in behavioral health programs. The bulk of those are substance use programs, which didn't surprise me at all. A needed category, very much needed across the state, I know. There were some others that were therapy services, referral services, things like that. We did have a combination. There were some nonprofits that are looking to serve multiple counties, which is good. You know, we really wanted to work with the regional approach because we know in many parts of the state, some counties just don't have the resource, but they may only have 1 or 2 kids that really fall under the kind of the category of these services. And so sometimes it just doesn't make sense to have a whole program in one county to serve just a couple of kids. So the regional approach was good to see under a couple of those. There were some counties that have attended the webinars, expressed some interest, and never opened an application. So again, not sure what that is. We've not done any outreach yet into that to kind of figure out, okay, what was your roadblock? What kept you from trying to decide to enter an application? So, you know, that's what we'll do at CJI is try to reach out to some of those folks and say, what is it that we can do to help you get across the border? We're going to do this again. You know, what's it going to take to get you guys to submit an application? Ultimately, as I mentioned, we'd like to do or need to do another round of funding. I'm guessing probably sometime maybe in the summertime would probably be a good time. Depends on how with these planning grants in particular, keeping them in mind, how long it takes them to get their things scheduled, to get their work groups together and figure out what it is that they want to do. If I have to do 2 more rounds of funding, we can certainly do that. The money, once the money's obligated, and I guess that's one thing that I want to remind folks, is once that money's obligated, it doesn't go anywhere. It doesn't carry over. So, or it does carry over from year to year to year. So as long as we can get to that standpoint with these dollars, we're in great shape. Ultimately my fear is, you know, 2.5 years from now, we've not spent enough of it. But I don't know that we'll be in that case. I think as we spread the word and more of this comes along, get these planning grants, you know, if you look across that, you know, 10 more grants could add another couple $1 million to that total. So that's kind of where we're sitting now. We're working to get the applications and everything on a team site. So those of us, because I can't email them all out because the files are too large, but working to get things on a team site so the members of that grant, whoever's on the grant review work group, will be able to get on the team site and review those applications with some priority for some to review.
Questions for Devin? Okay.
So Devin, you mentioned that once the funding is obligated, it stays with the county. entire fund, or are those funds reverting funds to fiscal year office?
I want to say yes, but let me double check on that and see. So it could be, it depends on what control category they're under. So what they may do is they could revert, but they may revert to what's called a legal fund, which means it's still an apparent fund. They don't go back to the general fund. But I'm not sure what category it's in.
I'm just, and one thought for future grant releases, whether or not it could be incorporated into the current grant programs, or if we could talk with the legislature about modification so that counties could specifically request funding for data support. So, I mean, I think, clearly probably within these, they could have a data component, but if we were looking for an ability to provide funding for counties for kind of an overall data person or a data team that would work across programs, across counties, across agencies, maybe that could be something that we could look at, and I think would certainly help us as we're trying to recruit counties into the data initiative.
Yeah, that would also be mentioned. I think maybe a legislative tweak for that, but I think that's good.
I would note regarding legislative tweaks, if we want to pursue one this year, December 12th, Representative McNamara is indicating is sort of her deadline to get things going. And so if any of you have legislative suggestions, you can get those to me, Leslie, Mark, prior to December 12th, and I'd be glad to talk with Representative McNamara about those things. I'm also meeting with her early next week to chat about things. And so if there are things that you've talked about in your work groups that need legislative cleanup, please let us know that. Otherwise, we may be waiting another legislative cycle. Dr. Osborne.
So, Deb, thanks for that overview. So helpful. I know for our group, we're working with several counties across the state on substance use and health particularly. And we kind of sent out some of these feelers, this grant application as a possibility. Like for a number of local communities, they just have a hard time identifying providers that will provide services. The workforce issue is so difficult on the community mental health side, the nonprofit side, the for-profit side, kind of urban, suburban, rural across the board. So I think that's a rate limiter thinking about new programs and the rest. So I'm not really sure what to do with that. I think Cirilla has some solutions. No. But I think more that we can do with outreach and being creative with providers at a local level, examples, that might be helpful to kind of lift up some innovative ideas to resolve more applications.
The other question I had was, is there any possibility that some of that money can be given to smaller rural agencies and grant?
So,
because I know for us, a lot of them struggle with cash flow and getting people on board. They need startup money.
So there's limits to that. I've mentioned this several times. So in the Indiana Code, advances are only allowed from funds if the language is in the fund to allow an advance. If that language isn't in the fund where the fund says it can allow an advance, technically I'm not allowed to do it.
So I had heard that before.
Yeah, it's under Title IV.
So this is a legislative cleanup item.
It very well could be. I'd probably a good recommendation would be to do that. But yeah.
Is that federal?
No, state.
Because I think that would make a difference since we identified those rural areas and those smaller providers. I don't think that they have the capability because that really streamlines the number of individuals that would be able to provide services.
Yes. The other caveat to that is if I do one, they have to provide invoice and supporting documentation for all of the expenses that we're advancing. And that's another issue. So if you want 60, I don't know, you get a $10 million grant. It's a big grant, $10 million, but say you get a $2 million grant and you want it all up front. I gotta have $2 million worth of expenses.
I would just think in most places, I know when we've done grants, it doesn't have to be that large amount, just enough for startup, and they know that cost. So I think if you can limit or say this much will be allocated, for startup to just get them kickstarted and get people on board. I don't believe I've ever had that much money to get to an agency would have a request in that amount.
Yeah, I'm not, I mean,
yeah,
I just picked a number, so I would never think anybody would request $2 million up front, but yeah, that is a limitation.
I mean, I think the Department of Correction does this with the community corrections grants. They give out quarterly, they front load it a quarter, so I think there's.
I don't know how that language in that.
Right, but to the degree that if there's language to mirror,
yes.
Then I think maybe looking at the DOC community corrections fund.
It would be, I mean, really all it would take is just in the establishing code for these funds under, what is it? Whatever the establishing code is for the funds, it would just need to be allowed a line in there that basically says advances are allowed. So it doesn't need to be anything super fancy. It just needs to be something in that code that says advances are allowed.
So I have one action item written down so far for legislation here, which I think is super important. The other thing that's percolating in my brain is the budget cycles for county judges. So I think most of them are on a fall type schedule. And so I think it would be immensely helpful if we could have the second round so the judges know going into their budget cycle what they're asking for, if they're asking for additional funds from their county. So regarding a timeline for the second round of grants. And then the other part of that is I'm wondering if we can target certain topics, like Mary Kay, Dr. Alsma mentioned data, which I think is an excellent idea, but I'm also hearing from juvenile judges that behavioral health assessments remain a real problem in the juvenile system. And so what is it going to take to tackle that problem? So is that reaching out to certain providers or larger providers who would have the capacity to handle these type of assessments statewide? Is it telehealth? Is it technology, infrastructure? All of these things that could be a targeted grant proposal or request from certain agencies that may be able to shoulder that responsibility.
So
go ahead.
Sorry. So we did have a couple of those actually that applied for that.
Good.
So I think what would be good, or what I think would be good, is for those who applied for programs, if we could invite them to a meeting at some point in time, especially if they have good programs, and implement them fairly quickly prior to the next round of applications are. We've done this with other funding streams at CGI where we've had them come and do, hey, this is our program, this is how we run it, and it's been successful. So I think if that would be particular for that topic, I just mentioned, like I said, I think we had a couple applications for that, of how they're doing it, how it's going for them, and the providers that they can use it, I think might be beneficial to other counties or other regions even on how they can apply for that type of thing.
Related to that, I think smaller counties see money coming, but they don't know what to do with it. I think you mentioned that as well. So to that end, at least as a former trial judge, I think it would be helpful to have a clearinghouse or even a website with vignettes of programs that are working across the state. Could be a one-page, in Ripley County, Judge King is doing X program that's working well, or in Huntington County, Magistrate Richardson has this program that's going well. And so counties without similar programs could look at those and see if there's a program already out there, so they don't have to reinvent the wheel and start from scratch to do something similar in their own county. I would be hopeful that perhaps IOCS could help with staffing and assistance in putting that clearinghouse together. If that's not something CJI would want to take on them. Any thoughts on that idea?
I think that's a great idea. We try to mention, there's a federal website that does a similar thing. But I think something more locally, folks actually, Judge, you've got a great program, and Jay County wants a program, and they know who to reach out to. It's a lot better than picking one off a website from Arizona has this program, well, that's great, but it works in Arizona, but our system's totally different. It would work. Having that resource, I think, for local agencies to go to talk to people that they know in the neighboring county and similar communities, I think would be extremely.
Judge, what I would imagine doing with the permission from Devin would be, once the grants are awarded, we could put a blurb on the YJOC website saying congratulations to these counties, here's what was awarded, and then that could give people ideas for the next round, for one, and then in addition to having the grants report or the diversion report, for example, there's a list of counties that we could work off that and then put that information on our website. I do think we would want to check with the counties, because Judge Kenworthy, I know that you know from experience that once people get wind of how wonderful your programming is, they come one, come all. But we could work with them to help them coordinate visits or distribution of information so that they don't come from it this month. I think there's a lot of potential there.
Is this also information that could maybe be distributed through JDI as well as the juvenile judges? Well, I mean, I know where the YJOC website is because I'm on this committee, but I don't know that the judiciary as a whole is necessarily at this point looking at that as an educational resource, maybe more information.
When the grants are awarded, we can put an announcement in the Wednesday message, you know, like letting people know that these were awarded, letting them know that there will likely be future grant opportunities, and maybe there's a multitude of ways that we can get the information out from the courts information side of things. And then to the degree that you all have similar distribution lists, so to speak, putting that same messaging in.
I could add that in JDAI, we have something that maybe we could build on. We do have an interactive map where you literally click on a JDI county and you see what programs they're doing just for their alternatives to detention. Some that are used free as a true alternative and some post dispositionally. It is not public facing right now. We have it on our internal, so coordinators, JDI coordinators can look at it, but it's something maybe we could build on. It's a Tableau dashboard kind of format, so to speak.
Other questions or comments for Devin regarding grants? Thank you, Devin.
Thank you.
All right, let's move on to the next work group, screening and assessment. And I think Michelle's going to give that report today.
Thank you, Judge Kenworthy. I apologize that she was not available to be here. She had a conflict today, so she's in training, and that's when I gave the report to her. So we were the screening assessment work group. I know Nicole was on that group. So if I miss anything, Nicole, feel free to chime in. Our charge was to look at and review or establish policies, procedures, and mitigation plans around screening and assessment, consistent with 1359's definitions and requirements. They added a lot of definitions and things like that, and these are not previously there. So that was part of trying to align what current practices and what current counties do, what's already in place with what the new statutes would require. So if you looked at our report, you can see we did a little bit of here's what we already have, and so here's how it fits and how we adapt the recommendations. So our recommendations did look at some policy amendments, some training enhancements, also connecting to data, because data and research is important, and assessments need to help with their work and foundational. One of the elements of our report I do want to highlight is kind of maybe not forward facing because it doesn't live in the recommendations, but lives in the narrative sections earlier. Our office had already engaged in revalidation studies with the University of Cincinnati on the tools that we have in place for the IAS. And those reports were released this fall to us, and we had a presentation to our office and some stakeholders. So we have those reports now. So part of the recommendations that the YJOC made regarding policy improvements or training improvements are being reviewed by IOCS training division in our office. But we also are trying to align what those recommendations look like with YJOC to recommendations for these other studies and reports, because they all kind of intersect. Talk about the same tools, talk about the same population of people who may need training or support or adaptations around how we implement things, suggestions on the adult side. So there may be some other policy discussions that come up from the juvenile side from those same players. So we're having those discussions, trying to bring all that together so that way it's a concise approach, but it's also parts. So that way we're as streamlined as possible and help folks get to the next phase. Any policy recommendations that are finalized and worked on through those processes would go to the board of directors and department of correction. So that would be the next step once those are place. We'll also have a next step of looking thoroughly with stakeholders around training stakeholders on tools that they believe the tools, how to use them, what's the best practices around them. So there are going to be opportunities for working with folks in this room, representing different stakeholders to also enhance those opportunities. That's kind of where we are, where we've been. So this is most of the IS work, but we also emphasize in our recommendations the need to do complementary assessments, additional assessments, the more information we have about you, the better opportunity we have to really meet their needs. So looking at how that fits in with JDI and all the other stuff is
Questions for Michelle? Thank you, Michelle. Next work group up, it's Cirilla.
Thank you. Our group was charged with looking at the diagnostic assessments and developing a statewide plan for behavioral health for justice involved youth. I had a co-chair when she left. Thank God Nick and Mindy stepped up and helped support the work we did for our behavioral health committee. So what we did with the diagnostic criteria, I think the underlying concern was removing youth from their community, home and community, and sending them for a diagnostic assessment. So we were charged with looking at what needed to happen so that the youth can maintain their residence in their home and community to get those assessments. So we talked about telehealth and how important that was to be able to use telehealth services, except for there are some instances where children need to have a face-to-face in that observation. So we identified the rules around HIPAA with teleconferencing. Also talked about utilizing resources from DCS, who has their division focusing on justice involved youth. They have provider lists and how we can enhance the capacity to use those individuals. Talked about how local counties can have an MOU with the CMHC, or how counties can regionally maybe apply for one of the behavioral health grants and look at how do you partner or contract with professionals in the area to be available to provide those evaluations. We also discussed training opportunities because they listed, we had a discussion, does it have to be a psychologist? Could it be a master level person who's trained to do assessments and do those evaluations and be able to be reimbursed for that? We found that what they like best is the thoroughness of the assessments that GOC provides and the ability to observe kids to give a thorough assessment. So that was some of our discussion. Also to talk about, do we need to have a criteria of questions before youth is sent? To ask questions like, what is their current diagnosis? When was the last time assessment was completed? And just more screening. On our committee, we had Dr. Doss and Dr. Mehta, who often said they receive kids that were not appropriate for that diagnostic evaluation. So having those discussions as well. Also, Medicaid is looking and has started some preliminary work in regard to 1115 waiver that will also help for juveniles. Because there was issues when once they're sent somewhere, they lose their Medicaid or they're kicked off of it. And we found technically that's not accurate. And so there's a period of time, once they're there, they still can have Medicaid coverage. So just really getting those things more consistent across the board. And just looking at policies, like, are there comprehensive policies around when is it time to refer? And having that little checkbox in place. Yes.
Interrupt, but I don't know what 1115 is.
1115 is a waiver, Medicaid waiver.
Okay, thank you.
There was an adult SMI 1115 for individuals who were incarcerated to receive behavioral health services. And so they're looking at for you 1115 as well. Thank you.
So the amount of time that they can maintain their Medicaid, is that long enough to actually get an assessment completed?
Or if they, so what we found out was as soon as they were there, their Medicaid was being shut off. So they could have had that time for that evaluation to take place, because DOC has a certain time that those kids are there. So I think there was just a miscommunication. So I think when they were being referred, they were just shutting that Medicaid off. So hopefully we can keep our eye on that. So, and kind of track how often that's happening and when it could be more appropriate to look at alternatives. I would say that to be true for the families benefit. We also talked about data and just kind of looking at the number of diagnostic and psychological assessments conducted, the demographics, the outcomes of the evaluations. A lot of times, what happens after they have the evaluation? They're sent home and there's not adequate services in the community, and then they're back in the system. Also look at the length of time who's referring to completion, whether that's to DOC or in the community. So we can begin to address what are those barriers in the system. The length of time in secure detention pending an evaluation, that was raised just as a question. The number of youth who go home after an evaluation versus how many stay in secure detention following an evaluation. So all of those would be data points for us to look at. We also thought it would be really good to have a mandate on an annual assessment by the oversight body to just really look at current trends and looking at the data and to see, I think when we looked before in 2021, there were 88 referred for diagnostic assessment. And just looking at the numbers and looking at the numbers that are being referred that don't get an assessment, whether it's through DOC or within the community. The behavioral health plan, just with the Indiana Behavioral Health Commission, looking at those recommendations, we are building our 90-day and mobile crisis response system and for sustainability. And that would cover every single Hoosier in the state, not just for justice involved. And so I think it's important as we look at that look at the partnerships we make and to identify is there any overlaps or gaps in our system that we need to address as well. We're also looking at our CCBHC, our Certified Community Behavioral Health Clinics. We're working now in an effort to apply for a demonstration grant that will also look at specific populations, look at evidence-based practices, the crisis continuum as well, looking at respite, crisis stabilization services throughout the whole state. So really excited about that, and also looking at a mobile response just for youth. So it'd be a mobile response stabilization service. So they're able to go in, address the crisis, and be able to be with that family for 90 days. So, and that's all about keeping our youth in the community and communicating with other providers who are involved in care as well. Workforce. We know workforce is a pain point in everyone's system. We have a dedicated work stream at looking at all of that. I think that is also an issue in this space as well. And what can we do to do cross training, education, and provide support? You know, there's always discussion about where do peers fall in this space, and I'm not sure because a lot of our peers with lived experience also have been involved in the justice system as well. So just some thoughts around that. One of the additional recommendations is around data sharing. I know a lot of times when youth are staffed, we always ask, where have you called? Where have you done? And some people don't know, but I know it's being captured in documents. Who have you called already? And so about how do we share that information of how many agencies have you called or how many systems has this youth been involved in? Always comes up. And that brings me to FSSA in partnership with DCS has a high acuity group that reviews youth. And I would say these are the youth that are reviewed are probably more of our most challenging youth in our system. And we try to come up with all kinds of strategies. We have a really good multidisciplinary representation. We have the Bureau of Developmental Disabilities, we have DCS, DMHA, we have the governor's office. So all those individuals are at the table trying to figure out, but that's only this big. As my good colleague will tell me all the time, we have like 10 more of those. And so it's about how do we really capture those cross-system youth and talk about what are some options and opportunities for them to be not a part of our system. The other is important is that we support the Family Youth Advisory. I think they provided a lot of important feedback from their perspective, experiences in the system as well. And evidence-based practices, I think that is very important, what we use in support the community and what's being done in other places. One of the things we're looking at as a part of the CCBAC is creating a center of excellence that will be looking at how can we provide support for evidence-based practices and fidelity and education. And I don't see why we could partner to include justice involvement and those agencies receiving money.
So a lot of action items in there, I heard. So questions for Cirilla?
have one on the multidisciplinary team. Is there anybody in the judicial branch represented, or how do young people who are involved in the whose current case, so to speak, is in the youth legal system, how do they get referred, or can they?
I'll try my best. So obviously it's a work in progress, right? So but we have staff, probation, youth, and they come through the DCS consultant. Okay. And so then the probation officer has joined us on the staffing, and we staffed several across the state. Yeah. That's how it's currently.
I made a note as I was reading the recommendations regarding the multidisciplinary team approach. Back in another lifetime, I sat in Grant County on the SHOCAP Safe Policy team, and that sounds very similar to what we did with SHOCAP Safe Policy on the local level. And so I'm wondering if there's room for some of these state level initiatives, providing a template. This is how you could do this and roll this out in your county. So
we did talk about that, and we also talked about maybe having something at the local, and if they cannot figure it out, how to rise that and elevate that to a state tier.
Sure. The other thought that I had as I read the materials was collaboration or coordination with the Behavioral Health Commission, making sure that there's a connection. I understand there may be a connection. Is that right?
Yes, there may be a connection. This year, the Behavioral Health Commission is small, but we have Dr. Yoder from IU will be focusing, and I will be providing support to her. So for sure, we'll be looking at how do initiatives here align with the behavior.
Other questions for Sorella? Comments?
Questions for is there any discussion around the state's criteria? Because I know other than the house using the state hospital, wherever, it doesn't mean they're not being housed. We all know they're still being housed and maybe not in the most appropriate places. Is there any discussion about reviewing that?
That is being reviewed now.
They are on the multidisciplinary.
Yes, absolutely. They're there.
Engaged in staffing this.
And we also, if one comes to my attention, I bring that up. So for sure.
Is it still 15? Is that right for the state? How many beds?
Do you know how many beds? No. EPC. I don't know, but we have the new NDI Daymar unit also, right? And then Sorella, have they expanded? They were creating
they did open
unit.
another unit
On the NDI.
On the NDI side, that's more the
older youth, and then EPCC in Evansville is the younger.
Other questions for Sorella? Ms. Terry, you're up next with transitional services.
But I'll jump in front.
I'm skipping all around.
Okay, I'm good. I like it. Okay. 1359 stated that we were supposed to look at least 3 months of transitional services to support reintegration back into the community. Recidivism. Before I jump any further, I always have to thank, I can't thank enough, Joseph and Tyler from Support Services. They were our committee's assigned staff, and there aren't enough thank yous. So they were awesome, kept us on track, kept me sane. It was the same as they can keep me. Okay, so anyway, so we were to the oversight committees to develop a plan and policies for provisions of transitional services. We actually have 7 recommendations. The first one was that the Oversight Committee determined a further study of provision of traditional services and the role of DYS, DCS, probation, and court plays in implementing services and is needed to determine the most effective procedures. The data work group will implement pilots. They talked about that in 5 counties to conduct a process evaluation of the juvenile justice system to examine the data and evaluation. So that was their suggestion that we, I'll say, piggyback with them. Recommendation 2, that we would collaborate with DYS, DCS to update and monitor TRP service standards for youth leaving DYS to increase the availability of services in all areas of the state, including rural areas, should determine which counties already have community-based transitional services. And then the Oversight Committee should review outcomes and cost structure for those. 3, as part of the statewide plan, we should adopt the following best practice for evaluating recommitment of a youth to DYS when youth are engaged in transitional services with probation under the jurisdiction of the court. Only serious probation violations should move to recommitment to DYS. And that goes on. Recommendation 4, the juvenile justice system should foster greater collaboration among state agencies to ensure that DYS and the courts are incorporating all available state services into the aftercare plan for youth who will soon transition out of DYS. There must be an ongoing communication between state agencies that are able to supply assistance, guidance, and relevant services to you. Recommendation 5, the Oversight Committee should continue to research and examine successful evidence-based or evidence-informed models of transitional and or reintegration services from other states to determine if any models could be adopted by Indiana. Grants being offered to the counties. Yeah, so, 6, the subcommittee of the Oversight Committee or another entity should review cases of youth referred to DYS who are only at DYS due to the lack of feasible alternative placements for the youth. There should be a multidisciplinary group of stakeholders from DOC, DCS, EMHA, probation, and other entities that examine this problem and work to develop solutions to that problem. And 7, upon the implementation of these policies and provisions, Oversight Committee recommends ongoing collection of data to evaluate the effectiveness and to develop additional best practice surrounding community transitional services and TRP services through DCS. What was next? We were the last group. I haven't even spoken to my group since our last Oversight Committee. I talked to Leslie just because I wasn't sure if all of the chairs are moving on. I don't necessarily need to be a chair. I don't mind being part of the committee. I'm not saying I won't be a chair or a co-chair. My co-chair is not interested in continuing, and I know that I have a couple people that were on our group that will not. I think moving forward is just determining what's next.
Questions for Terry? And Terry raises a good point, and I'll get to that a little bit later, but the marching orders for the work groups going forward. So the next meetings between now and February, we would like to make sure that everyone that is on the work group wants to continue on the work group. So I'm going to ask that the chairs talk with each member and find out who wants to continue and who may want to move to another committee or otherwise, and communicate that back to Leslie, Mark, and me. And that goes for chair positions as well. So we need to shuffle some chairs around or bring in some new folks who are interested in taking on a chair position. And then we're glad to do that. This is hard work and we recognize that. So, and I will tell you that my approach in this seat is to ask you, how can I help? And so you're welcome to give me homework, reach out, ask how I can help, and I will do everything I can to make sure that the work groups have everything that you need to move forward. And I'll get some more of the work group planning between now and the next meeting, but I did want to mention that, Terry, since you brought that up. Other questions or comments for transitional services?
I will add, sorry, just because out of the conversation that Cirilla had, we are unofficially having a conversation. DOC is seeing more kids placed with us because there's nowhere for them to go. We are not the right place for them. We're buying housing, kids with high acuity mental health needs. We can't program because they can't function at a high enough their IQ is not high enough. We're housing. So if we have already started conversations. Cirilla talks to me a lot. So does Sarah. They're my new best friends. They just don't know it. So those conversations have started.
Terry. Move on down the line to Tracy.
Okay, I was one of the co-chairs on the diversion work group, and this is something that I've been working on with my co-chair for quite a while. On the Children's Commission, we had a subcommittee that was looking at diversion before it became a thing in our juvenile code, because we knew that kids were being diverted for various reasons, and that counties were finding a way to do it. In fact, 2/3 of our counties were doing something else with those low-level kids that could be diverted. So our work group was charged with looking at diversion grant parameters and also just diversion program best practices and recommendations. And I'm not going to go too deeply into the diversion grant parameters because the grant work group did a great job in incorporating a lot of what we asked for, including letting there be regional partnerships and the options for community-based organizations to be part of that group that can get the grants, as well as allowing planning grants, which has been helpful for a lot of counties. It's a really long report, but if you look at it, there's a lot of information about what were best practices for diversion program parameters. So when these groups get together, we wanted to look at the target population and referral process, whether they're using community-based programming, which is the best, to make sure that these are being designed collaboratively so that there's buy-in from everyone in your county, not just the court saying, hey, we're doing this, or the prosecutor saying, hey, I'm doing this, but everyone talking about what their needs are and really working on it. And we wanted them to, yes, include data and look at data definitions and make sure they're building in something so that we can get data later to see not only how are we using diversion, but is it working. On top of that, we asked for a continuum, or for you to consider in each county that you have a continuum of options for kiddos, and that included looking at informal adjustment. We did make a little bit of a recommendation there, because informal adjustment's always been in the code, but we wanted to remind counties it doesn't have to just mirror standard probation rules, that you can be creative. You really need to tailor it to what your risk assessment or your diversion tool is telling you this kid's needs are, and making it something that is going to move that kid forward, not just be a checklist. So there's a lot more to it, but really the most important thing, I think, is our next steps, which we did. I think really Megan worked, my co-chair, did want this, and she's clairvoyant, because after the grants went out, I could tell Devin, I got a lot of phone calls about people asking, what the heck am I supposed to do? Our office isn't getting the grant. Do I care? What do I need to do? And also just wanting to know, what's the process? What am I supposed to be looking at? So we had made these our next steps, which is creating a resource or toolkit for counties to use when they go to implement these grants. And I think that is still crucial. From the calls I've gotten, I urged a lot of people just to get that planning grant because they were so not ready. They talked to one person. They had a great program, they thought, but they didn't really have any either getting together with everyone yet, and they wanted to get that in. So I think maybe having a toolkit for those counties that we can get to them to show them how to walk through this and make sure they're doing it right would be really helpful. So that's something that our group would like to work on. We also want to continue to review and highlight. There's a big section in our report about what Indiana is doing and some programs that we think are good or that are looking promising. So we would like to continue to review and highlight those for other counties to emulate and maybe do that more formally. I know you talked about putting it on IOCS somewhere on a website or on a map, something so people can, when they're having those group discussions and they identify their needs for programming, be able to point, oh, well, this county is doing something like that. So we'd like to also keep working on that, and then just the outreach and messaging so that people use your grants. And I know we have our winter conference next week. I will be messaging and outreaching on it with prosecutors to please give with your county judges and talk to them about what they're doing or if they've thought about getting these grants. That's kind of our goal. And I can't think enough Diane Maines, who was our staff person who supported us and helped us with everything, and my co-chair. And I think most of us are willing to stay on. I haven't checked with people a little bit, but I think most of you are just going to be.
Questions for Tracy?
I just have a statement. As we are working on our 1359 OJA report, there is a provision that requires counties to submit information regarding juvenile diversion as now defined in code. My perspective, and perhaps from the Office of Court Technology, Lisa's perspective, this is by far the most challenging data point for us to try to work through because of the way diversion is defined in code and some practices around diversion and use of formal adjustment, which is an entirely separate category. It's prosecutor's diversion, probation is designated as case management and record keeper, and that's just really tricky. So I think this is going to be an area where we need to spend a fair amount of time about it. Because as we're writing the report, it's not fun to write a report and say, we don't have that, we don't have that. Devin, I know you've done that. I actually looked at the mail report to see how you said that. And we're providing what information we have. And Tracy and I communicated about what could or should be kept in the prosecutor's case management system and what's a case management function. Because our report actually not only requires, how many kids went to diversion, it's under what offenses and what's their risk level and what are the services that have been required and what is the outcome. Pretty tricky trying to figure out how to do all that. So I just think that really does need to be a priority. And so as we begin working with counties more intensely, ideally we would try to work with counties who have previously adopted procedures around diversion that are consistent with statutory definition, maybe some other forms of diversion that we can try to navigate that as well. It's going to require some time, education, as well as some system modifications to get the information that we can.
I agree. Your email got us talking, because I got with Andre and we looked at what PCMS captures. And diversion, of course, since it wasn't in the code, was never anything to
check for us.
So there's no, and we tried to figure out if we could even parse out that information and it would have been useless. So we have a conversation in a little group going now to maybe fine-tune PCMS to capture at least some data points. It's not going to capture all of those things. That's not exactly how we use PCMS, but I think it can get some of that information forward anyway.
So we
hopefully
probably
in January
sit down and talk about how maybe between our data sets combined
moving forward. But in the past, good luck, because we spent a lot of time looking at that, seeing if we could define something.
Well, Lisa ran a bunch of reports and she's like, well, I have this, and I have this, and I can, so it's a patchwork.
Yes.
And it's, we made a very good faith attempt and effort to put in some information in this report, but it will definitely have some comments about what we need to ensure in connection with YJC to make sure we get this.
So I don't know, I sit sitting here and there's, I think we discussed this previously, is it seems like, unfortunately, when YJMC started and with the state budget cycle, there was a lot of pressure to get a dollar figure out to make recommendations for grants and to get those dollars out. Obviously, we're under money. Those dollars spent, or at least I don't have an obligation there when the next budget comes around. I'm not saying that the General Assembly will take the money away, but it's a possibility. It could happen. It just feels like the funding put the cart before the horse, because there's so much infrastructure and so many things that are still left. In particular, we don't have it solved with the adult population, juvenile population, with the youth population that we struggle. Dr. Osmond, you talked about it, and Cirilla, you talked about it, and Sarah, you've talked about it. Is we have all these workforce shortages, and I applaud the counties. Some of you are in here, and I looked at your applications, and I applaud your counties because some of you came up with really good programs to fund, and clearly you've got those resources, and you've got your finger on the pulse of the community resources that are available. But not every county is that way, and not every county has those resources. You know, and we're struggling to put. You know, we want to get the funding out there, but like Mary Kay, you talked about the data aspect of it. We've been talking about data and youth data and way to get good youth data for years and years and years. You know, these are great ways for us to spend the money and for us to do things like we're doing with the JMS project. You know, we can build something at the statewide level for the locals to use. It just seems like there's just so much left that needs to happen before a county can even use the money. And I don't want to say we're not to the point where I want to say we're setting ourselves up for failure as far as the funding aspect goes, but it just as we're sitting here, and all done. I mean, Tracy, Terry, and Cirilla, you guys have all done. Mary Kay and Dr. Alden, just bank work. And I've said this with Jared. There's a lot of really smart people around this. There's a lot of really smart people that we're working with, but money talks. And so I've just levied that as a concern that I have with this is, are we putting the cart before the horse with giving these grants out? It wasn't good timing, and we look to next year and we talked about that. And that's why with the county budget of running the grants on a calendar year cycle instead of the state fiscal year, because counties don't operate necessarily in the state fiscal year. Some do, but not all of them. But I want to make sure, like, what can we do from, if I've chosen to continue to chair the grants work group, what can we do? Is there something else we need to put together or another process that we need to put together to really take a look at the recommendations that were in the report? How many of the counties have had the opportunity to review and digest it? To go, hey, that's crisis response is something we'd love to build in our community, but they're waiting on what's the future of 98 before we do something. Again, I've got $20 million wrapped up in the behavioral health funding that will pay for that. The county's not ready to jump on that yet. So is there something that we can do, that I can do, that can help point the direction to where we can say, yeah, we know that the infrastructure may not be quite there yet. We know that your workforce may not be quite there yet. What can we do to kind of put these recommendations together? The counties that are like, yeah, we'd love to do something, but quite sure yet that didn't plan grant. Like, there's so much here, and I don't want to sound frustrated or exacerbated or whatever. I kind of am, because we run into this in other avenues as well. Like, it just seems like the money's the issue when there's so much work left to do, and they're not on the same cycle. So what can we do? You know, I don't know. Is that something
it's unfortunate that we have a short session coming up, because we would want, if we did a language change or have budget bill, so we could do a language change, not to change the amount, but to change how it's split up, that this much is for infrastructure, and infrastructure includes data collection and break that up so then it doesn't look like you're not spending the full 60, and how can you just divvy it up so you can build that foundation, you can help support those local counties, you can help them build for those counties who are still like writing into their systems to get it so it's all level set.
You know, I have something to say.
That's why I looked at you, Barry.
So I think first, the amount of the appropriation, the 60 million over 2 years, is just a testament to how important this is by the members of the General Assembly. I think that's great. I hear what you're saying about a lot of pressure to perform. Essentially, we get $60 million. Okay, we gave you what you asked for. My perspective is that it's reasonable to think, and I think we can communicate to the legislators that we did a lot of work in the year one. Now we're kind of in the building and then implementation phase, and that is a long process. If we are able to get some flexibility on how those funds are spent, open up the categories a little bit, I think we can figure out a way to spend a respectable amount of that funding without burning through it just for the sake of it. And I go back to the data. I mean, we have some significant needs relates to data at the state level and also for the counties. And so if you're a county, and I was in a county, I remember I got to collect all this data and I have no mechanism to do it. You're not going to give me one, and you're telling me I have to do it in a spreadsheet. Like, no, I don't want to. So if we can kind of get our own house in order on certain things as it relates to data, to provide the county some support in being able to do that. Our data report talks about a juvenile justice data warehouse. We talk about a centralized detention center application. I mean, there's a lot of ways we could spend more money, and it would be for the purpose, it would be for priority, and it would be something that would be built to last, that would get us incrementally where we need to be. So I understand what you're saying. I also think too that truthfully, people didn't have a ton of time to prepare for the grants. But, we had the session, and then it was like, okay, we're putting the application together. So I'm not shocked by year one applications. I mean, and if we kind of let that marinate a little bit, people wait and see what happens, we give them some time to see what. I think it'll be fine. I think we shouldn't panic. But I do think it's wise to have a message and a plan to communicate to the legislators. Some of this is anticipated, and here's what we propose moving forward that we think will position us and give the counties again some support in doing it with diversion and the other things they're going to.
Just looking at this, from what I've read, it looks to me like in order to secure some of these funds, at least the juvenile signature, right? Whether it's whatever. So then I think we have to ask ourselves the question: what these? There's three different buckets. One's diversion, one alternative, the diversion and the alternatives. That's essentially JDA. So we then need to ask ourselves if we juvenile, why would they decide to apply under this statutory scheme as opposed to JDAI? Right now, the JDAI funds are easier to secure. We're not going to win that if we don't get a legislative fix. And I've heard that from everyone. I know that's what Camilla is. I think that's probably what Devin is. So we got to ask ourselves, why would they sign up for this? And I think right now the answer, if you're in a rural county, is I won't. I mean, and your best evidence for that is probably the 3.2 million out of 60 million. I mean, we have 3.2. I think 5% out of 100% is an F. Not a mathematician, but I'm pretty sure I got that one right, Doctor. Right? So that's the way to look at these first two buckets. And I know I have other juvenile court judges here, and I've listened to everything. I'm just saying this is what the way they're going to probably look at it, right? So those first two items are probably, you're not going to get a whole lot of bite. Then the third item is the behavioral health. And whether it was
Cirilla or Dr. Alsma or Devin, Terry, all of you have expressed that we don't have providers. So we sat on maybe some money and we don't have any providers. I've just dealt with this issue as far as this grant and dealing with trying to secure substance abuse and mental health providers for other programs we have to grow in. It is very difficult. I don't know how we bridge that gap. Maybe part of the answer could be using some of these funds to increase the providers. To me, if we do not have providers that are willing to do it, number one, and good, number two, you're never going to get anybody to take this 3.2 is going to remain backless. So that's step one. We have to get more providers. Now, do I know how to fix that? I wish I didn't have the answer. I absolutely do not. You know, I don't know what that looks like. I think if you go into rural populations as far as community hospitals, what you will find is many times to secure a physician, you have to pay more than you would have to pay in a population center. And that's kind of an analogy of what we're kind of getting with the mental health is, you know, we have now as a society and as a state, you know, and as a legislature, you know, the leaders in the General Assembly, the leaders at the court level are seeing this is probably every bit as important as someone that breaks the leg, right? So then we have to ask ourselves, how can we increase then the funding in those sort of areas, right? The more rural areas to secure at least a master's level certified substance abuse and or community or mental health. Have to figure that out. That to me is number one. You know, and I know that one solution or one thought was like an MOU with CMHC. I know a lot of our smaller counties, I think we even have to do that statutorily. Now, if we pay $100,000 or whatever, maybe $200,000, what do we get back? Don't really know. But that is something wholly and separate and apart from this, you know. There's already an MOU, or there's at least already a funding structure in place. I don't know. Those are just my thoughts as a juvenile court judge, you know, because I'd like to see some success. You know, I think everybody would like to see some success. And success looks a lot like, and I think, is that the whole state has it. Not that one, you know, Marion County has it and Allen County has it, but that all the children have the opportunity services. Right? That's the goal. So that's just my 2 cents as a juvenile court judge, because those are the questions that they are going to be asking. Correct me today, Karen, as far as if you see it differently, but those are the questions they're going to be asking. Okay? Before they say, okay, one more program, you know, one more administrative task, one more, you know, duty for a probation officer that's already overworked. You know, we need some sort of something to entice them, you know. So, and that's probably maybe where maybe Darren and I would differ a little bit, you know, because I think he's saying, well, we don't have the infrastructure, but I would probably, and I get that, he's right about that. But if we don't give some sort of incentive, namely money a little bit on the front end, you would have no ability to establish. So that's probably the only way where I really differ.
It's the quantity of people available to do it, but it's also the quality of effort that any program, but if you don't stay through the model, it wasn't supposed to do. So.
That's my 2 cents, just from the new guy.
Well, number one, Judge King, you can see why we asked Judge King to join
Yeah,
the group,
yes.
right? And number two, I think you're going to be in demand when our work group chairs recognize you're not on a group yet. So they're going to be recruiting here. So what I'm hearing from these comments is number one, infrastructure and state level program assistance with certain issues. Number one, probably behavioral health assessments. I'm hearing that's just a sticking point for many of our kids in the system. So one question I had when I read the reports and looked at past reports as well was the state has been calling for statewide data collection for decades, and it hasn't happened yet. But we have funding currently that could at least move that ball in the right direction. And so what I'm hearing is that flexibility in the legislation is necessary so that we can use the funds in a way that can move this report forward. Is that a fair assessment?
I think so. I don't want to speak for Mary Kay, Dr. Alsma, but I would say yes.
So I'm willing to talk to Representative McNamara about that next week to see if this needs to wait for a budget cycle or if this is something that can be fixed sooner than that, so that there is flexibility in the use of the already allocated $60 million, so that we would have some flexibility for data infrastructure that can be statewide. And then for the work groups, I would invite each of the work groups to think about how we can use these funds in a timely fashion. So how do we get past these barriers that have been cited around the table today, and where are we going to get the biggest bang for the buck? So how can we attack the issues that are critically important at this moment in time, so that at the end of that cycle, we can say to the legislature, we can say to the budget authorities, look what we've done with your dollars. Look how we've improved things for kids across the state with the money that you provided. So I think that should be a key consideration for each of the work groups between now and February, and even between now and next week, if we're talking about legislation this cycle. But I will, if I have the consensus of the group, chat with Representative McNamara about the ability to put some flexibility into that money that we already had. Is there any objection to me doing that? Okay. All right. Any other comments regarding diversion?
Sorry, I had you.
Questions? No, I love this discussion because unless we work it out around this table, then it's not going to happen statewide. So I'm excited by these debates and these considerations because we in this room have the ability to make that change after decades of discussion, and that's really exciting.
I'll be brief. Cyril raised the point about community-based organizations, and I just don't want us to forget that the diversion works best when it is as far away from the core system as possible. And so thinking about how we can support organizations, particularly in rural areas, that may not be a DCS contracted provider because they are a small organization or something along those lines, but organizations that can take this and own it, and again, keep it as far away from the court as possible. That really is what works for young people. I'm happy to share research around that if anybody's interested. And just a reminder of that we all, I think, in here are system folks, so to speak, with the exception maybe of Kia, and always thinking about how we can give it back to the communities is very important.
I know in discussing with people, changing that language about advancing some of the grant funds could be huge for small counties, once again, because no one wants to take the grant administered. Even if you identify the community-based people, you're still going to need someone early on, and any grant's nice, but being able to maybe change that language.
Any other comments regarding diversion? Probation standards, Magistrate Foley.
So we have not met actually since, I want to say, I'm referring to the always fabulous Colleen Saylor, who was our IOCS staff member on our committee, and we also did take it back. And Joel was on our probation standards work group. we were a kind of odd man out, I think, in that we needed the input from the Youth Justice Oversight Committee, but the actual authority over probation standards remained with the judicial conference. So we had the additional task to convince not just the conference probation committee about these new probation standards, but also the board of directors of the judicial conference. So House Enrolled Act 1359 was very specific as to our tasks in that it wanted us to look at probation standards regarding the consistent use of validated risk and needs assessment and screening tools, basically IRAS and IS. Use specific probation standards, including conditions of probation for informal adjustments as well as formal adjudications, collaborative case planning, standards regarding out-of-home placements for residential treatment facilities, the commitments to the Department of Corrections, as well as probation standards regarding incentives and sanctions used. So we had an amazing work group. I'm keeping this really short because I know we're running out of time. We had an amazing work group. I worked pretty hard. We had lots of really interesting, sometimes dramatic debates. We did have to break down into smaller groups in order to meet our deadlines because of the deadlines of the judicial conference. So we actually had the probation standards as they are written within the final report adopted by the judicial conference on. We have started the training for probation officers as well as the judiciary. I'm presuming that's going to be ongoing from here on out. I'm still happy to help with that. So in a nutshell, it's all in the final report.
Thank you, Magistrate Foley. Questions or comments? So I think it's fair to say that the Probation Standards Committee has done their work and probably can be absorbed into other committees. Is there any objection to that?
I think our task has been, was there any kind of outreach to not just obviously the probation departments, but to other players in the system about standards? I think so far as training or just educational, as far as, you know, are the public defenders and prosecutors made aware that there's been these changes?
We had, well, I'll let you.
I can speak for me. Adding in the link to the probation standards into our training manual, try to, you know, explain there's been some significant changes that you want to be able to pay attention to, and encourage defense attorneys to review those so they can work with probation officers to make sure that they're being adhered to for the benefits of their clients. So I think it may just be a task for all of us here around the table to connect with our people.
We did have a couple of prosecutors on our group as well, so I know that was one of the things we were talking about, as well as additional training on the IS in particular, about what it means, what you do with it. Okay, you got to score a 6. What does that mean? So I think the educational opportunity is huge across the entire system.
Thank you, Magistrate Foley. I'm going to briefly ask Kia to give an update on the Youth and Families Committee.
We have continued to meet at least monthly with about half of the members, so it's really cool that they were willing to stay engaged. They have engaged on a lot of different initiatives with us. We just went to Houston a couple of weeks ago for the Casey Foundation's Equitable Justice Systems conference, and we got some really good information and brought back some really cool things to build some teams here. We were also part of the Probation Experience Project with the Casey Foundation, which was a nationwide kind of research gathering about what young people and families' experiences were. And what they wanted me to raise today is just ways for them to stay engaged with this work. One thing is they are I would just like to raise, if there is a way to keep them engaged in this process, if there's room on the committees for them, or even checking in on monthly, quarterly, or however we can design that, I would very much so like to continue this work with you.
Thank you, Kia. I love that. They're looking for results in a group. Good for them. Any questions for Kia? We are tight on time, and I recognize I skipped the action item out of the gate, and that's approval of the minutes. Any discussion about the minutes? Thank you, Nancy. Do we have a second? A second. Second. Thank you, Magistrate Foley. Any further discussion? All in favor say aye. Aye. Opposed, nay. Minutes are approved. All right, you've got the future meeting dates. Just in wrap up, I would ask that the chairs set a meeting between now and February. Let us know if you no longer want to chair your committee. Let us know if you have members who no longer want to continue. Those of you who are new to the committee or are not currently on a work group, you've heard the summaries of what they've been up to and where things are headed. And so please let us know if you would like to join one of the work groups and which of those you would like to join. I would also ask that each of the work group chairs put together an action plan for the next meeting. We'll be sending just a general template out as guidance for that discussion. So looking at short-term and long-term action steps, are there items in your recommendations that are low-hanging fruit? Are there things that we can just pick off right off the bat and take care of some of those? Are there items in the report that need additional due diligence? Do you need technical assistance? Do we need to bring in experts to talk about different parts of the system that we need more understanding of? Are there items that need additional support before we take action on the recommendations? So essentially looking at the recommendations we put together and figuring out how we take the next step forward. I would also ask all of you to please let me know if there are items within your work group that you think need legislative cleanup ASAP so that I can convey those to Representative McNamara. And also on your action plan, just keep a running kind of legislation section down there. And then for the group as a whole, do we need additional work groups to take care of this? Do we have such a heavy load on certain work groups that they should split into two and break out some of those tasks? Do we need a legislative work group, for example? So think about that for the February meeting, how we structure the individual work groups and also structure the large group as a whole. Any comments, questions regarding that plan? Anything additional for the good of the group? Dr. Alsma?
So nothing regarding that plan.
Yes.
Sounds like a good, ambitious plan. So good luck. No. I wanted to come back to Kia's report. I actually don't have a question, just a statement. So for anyone that hasn't been on Voice's website, you should check it out. There's a great report of the experience that young people had with this. You should check out. There's a family care council that Kia and her staff are helping to support with Marion County and juvenile court with the voice of parents and youth. Good experience. So just check out the website because you're doing amazing work in Marion County, Indiana, now at a national stage. It's pretty awesome. Just want to put that up.
Thank you. I appreciate it. Thank you.
Yep.
Other questions, comments? Nancy?
Just because he raised it, Dr. Alsma and his group just had a report published around the caregiver experience with juvenile justice. I sent that to the JDI coordinators this morning, but if anybody would like that, I'm sure he can share it, but I'd be happy to share it also. That was had some really key findings around bringing caregivers and building partnerships with justice professionals.
So perhaps when we send out draft minutes, we can send out a link to the Voices website to the report project that Nancy suggested. Leslie, is that something we could do? Yes.
Sorry. So when we were talking about legislative changes, I know generally we all got a vote before the body before there were any legislative. I know most of this that we talked about is just tweaking and things that we've already
And I will be reaching out to set meetings with the chairs. You're welcome to bring co-chairs and your staff from IOCS if you want to. I will come to you for those meetings. So let me know how you prefer to meet. I like in person, but I can do Zoom if I have to. So just let me know. Anything else for the good of the group? All right, I feel like this deserves a go team. Go team. Thank you, everyone.
Right.